In Australia recently, we've had quite significant changes in both the AHPRA guidelines and also the TGA guidelines that are applicable to practitioners who provide cosmetic medical services, both non-surgical and surgical. In terms of the AHPRA guidelines, they've just become a little bit stricter in terms of the type of consent that's required, the need to take financial consent for patients before they're treated, and also the fact that you have to supply the patients with all the forms that you've asked them to have a look at. You need to provide them with very clear aftercare instructions, and those aftercare instructions should include the potential side effects and complications that they might experience after the treatment, and also how to manage those side effects and complications. That needs to be part of the documentation that's given to the patient after the treatment. The other thing that you have to do is you have to make the patient aware of who you are and what your qualifications are. And finally, the patient has to be able to contact you after the treatment. And if you're not available to be contacted after the treatment, you then need to provide a backup method for the patients to seek help if they need any assistance from you after the treatment. But I've found that it's actually been pretty easy to implement all that information into our consent forms and our aftercare forms, and also into the paperwork that we ask the patients to fill out before they come to their appointment. One other thing that we are required to do now is to perform a psychological assessment. For non-surgical treatments, if you feel that there's an issue with the patient and they might potentially have body dysmorphic disorder, this is something that you need to explore further with the patient, or you might choose to refer them to a psychologist or a psychiatrist. For surgical treatments, it's stricter than that they have to be referred if there's any suggestion on a screening questionnaire that there might be a psychological problem that needs to be dealt with before they have a surgical treatment. But for those of us who are doing non-surgical cosmetic treatments, it's basically we perform a screening questionnaire, and then you have to use your own judgment whether the patient needs to be referred or not after that. In terms of the TGA guidelines, they affect advertising of non-surgical cosmetic services, and the main one relates to Schedule 4 medications, so botulinum toxin injections and dermal filler injections and other injections such as bioremodeling injections or biostimulating injections, so any Schedule 4 medications that we're doing. So the advertising guidelines are now quite strict. We are not allowed to mention terms that we have used in the past, like anti-wrinkle injections or dermal filler. We can't name drugs, although we've never been able to name drugs. And we're also not allowed to use before and after images if it's clear from that image that a Schedule 4 medication has been used. So in the context of Schedule 4 medications, we're only allowed to advertise that we provide consultations for certain conditions that patients might seek treatment for. So what we do in our clinic is we just encourage all new patients to come in for a comprehensive assessment and consultation with one of our practitioners, and at that consultation we can then discuss whether Schedule 4 medications are appropriate for that patient. But it does unfortunately reduce your ability to attract new patients through before and after images, and you also have to be aware that you cannot have that imagery and you cannot have those terms on your website. But I find that patients are actually becoming quite well educated about aesthetic medical services, and a patient is often these days not looking for a quick fix. They're not looking for, okay, I just want this treatment and then I want to come in and be gone. They're actually often looking for something a bit more comprehensive, where they want somebody to assess their skin and their skin quality, and they want a comprehensive treatment plan. So I think advertising that you provide that is actually a good thing to be doing going forward, and it's probably going to make the industry better for all of us.